Okay, next we're going to talk about ordering equipment. So whenever you're seeing these patients, there's going to be times where they need outside DME. You know, whether it be a walker, whether it be a cane, a wheelchair, we can help get that for them. One of the things I would recommend is to never say that we will get this for you. Depending on their insurance, sometimes insurance approves equipment, sometimes they don't. So if you set this precedent of they will be receiving this equipment, sometimes that can lead to a lot of disappointment on their end. So if you do want to order equipment, there's a couple processes that need to take place. So we've already talked about verbal orders to change frequencies. Well, you will use the same verbal order to order medical equipment. So if you're in there seeing a patient and they need a walker, well, what would need to happen is you need to go in our system, document a verbal order, and within that verbal order it will state why the patient needs a walker, some sort of objective measurement to validate that. You submit that verbal order and then then notify our office so they can get the ball rolling. What they do is they take that verbal order, they send it to the agency sends it to the DME company. The DME company approves it or doesn't approve it, and then it goes all the way back to you. So really our job is done after we submit that verbal order. Usually the DME company interacts directly with the patient, and any questions that the patient has about when is my walker going to get here, or is it going to cost me anything out of pocket, I would defer all of that directly to the agency, because really we would just play the middleman within that, you know, direct them back to the agency to say, you know, our job is to submit the order, and they're the ones that does all the follow-up on that moving forward. So again, for DME orders, whether it be a walker, cane, a trapeze bar, a wheelchair, submit a verbal order and notify our office that it's in there, and then we can do the rest.